Imagine wanting to smile, but your face won't let you. Coming up today, the treatment's giving people control of their own expressions. And good morning. It is Friday, March 10th. I'm Jessica Lovell, and welcome to the Morning Medical Update. Losing control of your face changes how you speak, how you eat, and much more. Today, we hear what it's like living with those challenges and learn about the highly specialized treatments that some patients don't even know exist. Let's start, though, with this morning's morning rounds. Senator Mitch McConnell, you may have heard, remains in the hospital after tripping and falling at an event Wednesday night. The 81-year-old suffered a concussion. It is the second time in 4 years he has needed to go to the hospital after falling. So joining us live now is Dr. Jessica Kalender-Rich, who specializes in geriatric medicine here at the University of Kansas Health System. Dr. Kalender-Rich, good morning. How are you?
Good morning. I'm good, thanks.
Always good to have you. We know you've never even met you have never met Senator McConnell. He is not your patient. But generally speaking, how often do you see geriatric patients hospitalized after a fall?
Yeah, I mean, it actually is not common as we think. We know that people over the age of 65, more than a quarter of those folks will actually have a fall each year. But of those that live out in the community, like Mr. McConnell and many others, only 5 to 10% of those falls actually result in hospitalization and major injury, things like fracture, head trauma, or like a major laceration.
So Senator McConnell's team says he'll be observed in a hospital for the next few days. Is it common to keep a concussion patient hospitalized for more than a night?
I mean, I think, first of all, we don't know the details of his medical condition and exactly what's going on, and every case is going to be different. I would say more commonly people will stay just overnight, but certainly I suspect they're taking every precaution that they can to ensure that he's as ready to go as he can be when he leaves.
Yeah, because he's out there and about there. So why does balance and steadiness get worse as we age? What's going on in there?
Yeah, so I will say it doesn't get worse for everyone, but for a large majority of people as we age, our balance and steadiness get worse, which puts us at higher risk of falls and all of the downstream effects of falling. And that's partially related, it's actually a lot related to strength and stability. You know, we as a community tend to move less as we get older. We might be weaker, we might have lots of medical problems, and we might just have less maybe motivation to get out and about. And so the less we move, the less we can move, and that leads to us losing some of our balance. Of course, some people will also have, specific medical conditions, things that might be neurologic or other things that would put us at higher risk of losing that balance and steadiness as we get older, plus medications that tend to stack up as we age.
Sure. And Doc, we've talked about this, about keeping the mind sharp, and this is kind of what you were just talking about. But how does somebody keep their balance sharp as they age? Any tips?
Yeah, really important things are to move. It's one of the few things that we can actually say in medicine that if you don't use it, you lose it. We have to keep moving. That means, standing on one leg and being able to move, the other leg around to maintain your balance. Maintaining core balance is really important. There's things like Tai Chi and yoga, chair yoga especially, that have been shown to really help people maintain that strength such that they can then maintain their balance, because the thing that keeps us moving moving but stable is our core. And the core is often the thing we think about the least when we think about movement. We think about leg strength, but you really need that core so that if a big, huge gust of wind comes by or a grandchild comes up and almost knocks you down, that you can right yourself.
All right, help us out with this last question. So if someone younger wants to talk about fall risk with an older relative, we know it can be a sensitive conversation, but what's the best way to approach it?
Yeah, and I've had to do this with my own relatives. The way that I approach it is, gosh, I really want you to keep moving and stay healthy as long as possible. I want you to be able to keep doing the things that make you happy, and to do those things and to be able to get out and be as independent as you can be for as long as you can be. We've got to keep moving. And so even things like silver sneakers, where you can get free access to community pools and community gyms, or there are lots of other resources out there. Those things, I really encourage people to do that. And the other thing is, we know to keep cognitively sharp and physically sharp, like community and talking to people, right? So encouraging people to keep walking with their friends, or even to say, hey, Mom, let's go take a walk together. Those things can be really important.
Dr. Kalender-Rich, you're always so helpful. We appreciate your time today. Thank you.
Thank you.
Well, today we are joined by a professor and author who survived a brain bleed. Louise Krug had brain surgery that saved her life, but it left her with some physical impairments. Louise, good morning. How are you?
Hi, good. How are you?
Good. Thanks for being with us. Here with me in the studio, here in the Dolph C. Simons Jr. Family Broadcast Studio, that is Dr. John Flynn, a surgeon who has a passion for treating facial paralysis. Good morning. How are you?
Morning.
Good
Thanks for having me.
Yes. And Casey Blair is a registered nurse working with Dr. Flynn here in the Ear, Nose, and Throat Clinic at the University of Kansas Health System. How are you?
Good. How are you?
Good. Thank you for being with us. A lot of people understand how a stroke might cause their face to droop, but Louise, talk to us about, in your case, facial paralysis happened after a surgery. Tell us what happened.
Yeah, well, I had a cavernous angioma, which picture like a raspberry, in the pons of my brainstem. So that bled. So to get that out, they had to disturb some of the stuff in the way, which was, among other things, cranial nerve 7, which eventually controls your facial nerves.
I love it when patients explain things so I can understand. The little raspberry in there, I can kind of picture it. So thank you. They usually explain it for people like me, and I love that. Louise, how long have you been living with this facial paralysis?
Oh, sorry. Let's see. This happened when I was 22, and I'm 40 now. So a while.
So how does it impact the day-to-day things, the eating, the speaking, putting on makeup, all the things that we just do innately? How does that impact you?
I mean, it's hard to say now because I've been living with it for so long. I think speaking is probably the hardest thing because I'm a teacher. So, there's sometimes I just have to make sure to enunciate and to really practice that. Definitely not applying makeup. I get to apply it how I normally would. And then eating, not so much now, but I can remember, shortly after my surgery, I went to Subway with a friend, and I was just sitting there with this sandwich, and I was like, oh, how am I going to do this? Like, what's going to happen? So, there are certain things that I can't, that I don't know. But I don't think about it as much anymore.
And that's good to know, because we know there's a lot of people dealing with it now. So that's where you can come in and help them out and be an inspiration to them. But you mentioned the sandwich, and my next question was, how does this impact just your social life? Those simple things that, again, we all take for granted. We can go out and grab a sandwich with somebody, but you're saying that you did have to learn how to navigate those social situations, correct? Tell me about that.
Yeah, early on now, it doesn't really affect. Well, I may get more shy. I may be slower to open up, but not my social life anymore. But I think definitely at the beginning, it was definitely something I was very self-conscious of, for sure.
I want to turn to Dr. Flynn now, because there are two types of facial paralysis, and you brought some photos to show us.
Yeah.
Tell us kind of what we're looking at and the two different types.
Yeah, exactly. So whenever I'm meeting a patient with facial paralysis, I'm kind of trying to categorize them into two main kind of types of facial paralysis. So the first one that you see pictured here is called flaccid facial paralysis. And so this is what we all very commonly think of when we think of somebody with facial paralysis. They can't smile, the corner of the mouth is droopy, the eyebrow sags, the eye doesn't close all the way.
And what kind of episode would happen for this to be the result?
Yeah, so this is going to be most common. So sometimes it's due to a stroke. Sometimes it's due to a cancer or a tumor that's growing in the face. The saliva glands and the skull base are probably the most common. But then also infections, like this patient had an infection that caused the facial paralysis.
Okay, and we have another type, post-paralytic palsy.
Yes, so this is the other category that we more frequently see. So this is probably most common after Bell's palsy. And patients have an acute episode where they lose the facial nerve function, but then they have a recovery. And in this recovery, there's an aberrant regeneration or an altered regrowth of the facial nerve in which it becomes cross-wired. And so this is a very different type of facial paralysis or facial palsy. You can see here from this patient, the left side of her face, the healthy side, has a great smile. But then when we look at the other side, her right side, the oral commissure, the corner of the mouth, doesn't move well. But while she's trying to move that, her eye is closing on her. Her eyebrow is lifting up. She's getting tightness in the midface and in the neck. And so they're very different problems, and they're treated very differently, which is why I have to separate them out.
So let's talk about that treatment. You can treat this, and you're moving nerves around. Tell us about this.
Yes, so in the flaccid facial paralysis type, those patients need nerve input into the muscles to help them move. And so if the patient is known to not be able to have a recovery of their native facial nerve function, so maybe during a cancer surgery the nerve had to be resected, well, those patients need to have nerve input put back into the face to move those muscles. So there's a couple different options you have. Probably the two most common are the chewing nerve here, called the masseteric nerve, as well as the tongue nerve called the hypoglossal nerve. So they give you different things, and so there's different reasons to select one versus the other. But if the facial nerve is thought to not be able to recover, and the patient needs to have nerve input back into the face, then moving some of those nerves around are very beneficial for them.
And how new are these type of treatments? I mean, if you went back 20, 30 years, would people have these types of options?
They have been around a while, but they've been refined a lot recently. And so I think as time has gone on, people have had better successes with them. Now, there is more treatment options. In long-standing facial paralysis, the muscles of the face actually lose their ability to function and move. And so in those instances, doing a nerve transfer procedure won't help them because the muscles don't work. So in those instances, borrowing a muscle from the leg and doing a muscle transplant is actually what we do in those instances.
So Casey, I would bring you in here. Your nursing background is surgical oncology. You help with cancer patients, and there's an overlap, as Dr. Flynn was just mentioning, between cancer and facial paralysis. Tell us a little bit about that.
Yeah, so I'm pretty new to the facial paralysis world. I wasn't expecting a ton of overlap, but I have found since working with our patients that the overlap that I see is impact on quality of life and the kind of emotional aspect. And I think that it's really meaningful for me to get to join in with patients and kind of care for them in that way as well.
And talk about treating patients as whole human beings. What does that mean to you?
Yeah. A lot, I would say. I think in healthcare it's so complex now that we can get kind of lost in, with the complexity, just treating physical portions of patients' care, and so I think it's really important that we view it holistically and make sure that we're caring for patients as human beings as well.
Dr. Flynn, same question.
Yeah, I think particularly with facial palsy, it's really important. So when a patient has an acute episode of facial paralysis, it makes them feel like they've lost their identity. I mean, our face is our identity when we wake up and look at ourselves in the mirror every day. And so it affects them, I think, physically, obviously, but also mentally, emotionally, socially. This is a form of nonverbal communication. And so helping patients cope with that and understand that, and treating them not only physically, but helping them with that social and emotional aspect, I think is equally, if not maybe more important.
Yeah, you said it, the smile, the face. It's everything. It really is. And you do all kinds of facial surgery. We think of it typically as facelifts, rhinoplasty, reconstruction, I mean, perhaps even after a bad injury. But in terms of complexity, how do you compare these types of procedures that we're talking about today, to those?
So they all build on one another. And so all of the surgical training that I had during my ear, nose, and throat and head and neck surgery, residency training, I think it all just builds and builds and builds. So a lot of the facial plastic surgery, like facelifts, rhinoplasty, those have very similar technical approaches to all of the facial nerve, facial paralysis cases that I do. Additionally, a lot of patients with facial palsy have difficulty breathing through the nose, and so I'm using rhinoplasty techniques to help improve breathing through the nose. And so while they're different and each is challenging in their own way, they all do build with one another technically.
Is this offered a lot of places?
Yes and no. So here at KU, my goal is to really build a comprehensive approach to patients with facial paralysis, so we can offer them the whole gambit of treatment. And so while some people might offer some parts of facial paralysis treatments and other places may offer a different thing, we want to offer everything so that patients can really have a very comprehensive approach.
Yeah, very narrow focus on different for different types of treatments. So Louise, how did you first find Dr. Flynn?
Well, it's actually kind of funny. I was scrolling through Instagram, and I saw this surgeon in Beverly Hills who did like facial paralysis work, because I had gotten curious about trying again after like 17 years of just not doing any surgery at all. So I told my husband, I was like, I don't want to go to Beverly Hills for surgery. Like, let me just email Dr. Crete, who is at KU, who did the hypoglossal nerve transfer on me like 17 years ago. Let me email him and like see if there's anybody who does these techniques or these procedures. So I did. I emailed his nurse, and it was so funny that she got right back to me and was like, oh yeah, Dr. Flynn, why don't you come in for a consultation? And so I did.
Just like that. I didn't know where she was going. I thought she was going to say you're like Instagram famous or something, and I had totally missed out on that memo. Thank God.
Yes, exactly.
Right. So Louise, how do you feel about your most recent surgery in comparison to these last many years?
I don't know. We'll see. I mean, I feel good. But we won't be able to tell until the summer. So, we'll see.
Tell us, Dr. Flynn, about that recovery, how that works. I mean, I would imagine anybody going through this would want to see those instant changes, but it's not so easy.
Right. So Louise's surgery was about 2 months ago. And so when I transfer nerves, which is what she most recently had done, they have to grow into the muscle. And so the nerves grow extremely slowly, about 1 millimeter a day. So that's about 1 inch a month. So typically after this type of surgery, it takes about 6 months before we know the final result. And so it really is an exercise in patience that Louise is going through right now. Right. So ultimately, we'll see how her nerve transfer procedure worked, but hopefully we're expecting a nice smile and good results.
Okay, well, we'll get this crew back together again, and we'll see where she's at here in several months. Casey, what's it like when you finally see people seeing those results in clinic when they come to see you?
Yeah, I'd say for surgeries, it's definitely a slower process, like Dr. Flynn talked about. For things like functional Botox, we can see results a little bit quicker, but I think it's always special when patients start to share the impact that it's had on their lives.
Yeah, way more, way more than skin deep.
Yeah.
So if you have questions for Louise, for Dr. Flynn, or Casey, send them into YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. Let's get a quick check on our COVID count. Dr. Dana Hawkins is with us, Medical Director of Infection Prevention Control. Happy Friday.
Yeah, I know.
How are you?
It's good. I'm good.
Good.
Glad that a lot of people can just hopefully hang out, and there's a lot of things to do this weekend in the city, and of course watching basketball is probably going to be a major one as well.
I knew you were going to say that.
But there are other things too. Right now in the hospital we have 50 total COVID patients. Of those, 25 are active, 5 in the ICU, and 2 on the ventilator as well.
Okay, Doc Hawk, we know you're keeping tabs on the current bird flu outbreak, H5N1.
Yeah.
Got to get that straight. We saw this headline: U.S. considers vaccinating chickens as bird flu kills millions of them. So for now, that's just an idea, but some industry groups may not be on board with it because it could hurt their bottom line, of course. But Hawk, you work with humans, not animals, but you're still keeping tabs on bird flu. Thoughts on vaccinating chickens? I know that's not who you treat.
I don't know too much about the veterinary sciences or what goes on in that realm of business, but I do know that for food production, we know that vaccines are given to different animals, probably chickens as well, but certainly beef, cows, pigs. Also, antibiotics are used quite a bit. I think they are looking at just trying to help preserve some of the morbidity of these chickens. We know that there has been multiple millions of food chickens killed or culled because of this H5N1 epidemic that's going around in the fowl. So I think it's a good idea. I think we need to do everything we can to help protect the animals that we work closely with, because it does help the food industry, it helps business overall, but that can also hopefully help reduce the chance of the spillover to humans. We know that there have been a handful of human cases of H5N1. All of those cases really of humans getting the infection have worked closely with those birds. So if that can help reduce that chance of spillover, I think that's a good idea overall.
All right, Doc Hawk, thanks so much. Any reporters on the line today? Let's get to our viewer questions. Judy wants to know, does insurance pay for this?
Yes, everything that I do related to facial palsy, insurance covers, and that includes the Botox for patients that have this post-paralytic facial palsy, because that's a mainstay treatment for them. So yeah, insurance does.
Okay, Janet is asking Casey, because you mentioned functional Botox, which is probably what you just mentioned, but dive deeper into what that means. As I think we hear the word Botox and we think, boom, right in the forehead, fixing wrinkles, but functioning means much more.
Yeah, so kind of tying into what Dr. Flynn just said, insurance covers it, and it's something that we offer for patients with synkinesis, if you want to kind of speak to the details of it.
Yes, so like in the photo we saw earlier, you have that aberrant regrowth of the nerve, and so it gets cross-wired. And so the main goal of Botox is to weaken the muscles that are antagonistic to the smile or causing the eye to close too much. So maybe weaken the frowning muscles a bit to give you a bigger smile.
All right, so I have a question from Brad. And Louise, Brad wants to know, how did you talk to your kids about the difference in your face? Or another question might be, how do you talk to people when they ask you, or do they?
Oh, yeah, I do talk about it fairly often because as a professor, I'm always in front of people. And I find that it's better if I get it out of the way. If I'm feeling like it. Sometimes I don't feel like it. But I think with my kids, it's obvious. They just knew that I looked different. And so I think I, just in 1,000 little ways, just talking about it. And I think they've never known anything else. So yeah, I don't know if that's a good answer, but that's all I got.
No, it really is. I mean, it's a mom's face. There's nothing better than a mom's face. You can't, no matter what. So another question that Tina had is, are there certain foods that you avoid, or is there certain things that are harder to eat than others?
No, I don't think so. Not anymore. I think all of that has just gone away. But like my Subway story. Anytime a sandwich is 3 inches or larger, but that's probably most people.
Well, last question I want to ask is from Angela. She wants to know, is there a difference between facial paralysis and palsy?
Sure. So palsy is in kind of the umbrella term, I would call it. So facial paralysis is like absence of movement. And then there's another term called facial paresis. Paresis means weakness. And so palsy incorporates both of those.
Okay, so Bell's palsy, we hear that a lot. Is that pretty frequent? Does that happen more often than others?
Yeah, Bell's palsy is probably the most common reason I see a patient with facial paralysis.
And what would cause that? Because we just hear that popping up for somebody, and there's really no rhyme or reason why. Yeah,
so it is an idiopathic process, meaning we don't know exactly why it happens. Now, the leading theory is that it's caused by a reactivation of a virus that lays dormant in the facial nerve. It causes the facial nerve to have inflammation, which the facial nerve travels in a long bony canal. And when it has swelling and inflammation, the nerve dies off and has to regrow. And so that's kind of the leading theory. Really interesting learning about how you are giving these patients, these really unique patients and cases, great options and treatment. Yeah. So thank you for that. Let's get to final thoughts, and let's start with you, Casey.
Yeah. I just want to say thank you to Louise for being here and sharing part of your story. We think you're awesome. And then thank you to everyone here for putting in all of this work and allowing us to be here to speak about Dr. Flynn's facial paralysis practice.
Well, we already talked before the program. You'll be back already. Dr. Flynn, your final thoughts. Yeah, thanks again for having me, and thank you very much to Louise. I think she was supposed to be traveling today, and she changed her plans to be here with us, so I'm very appreciative of that. This is why. And thank you to Casey, because this facial palsy is a journey for these patients, and it is an honor and a privilege for, I know, both of us to be able to help patients and be with them along this journey. Well, and you said it, we cannot do these stories without people like Louise coming forward and sharing, and it's not an easy one when it has to do with kind of that outward appearance. So, Louise, thank you. Thank you so much for sharing. Your final thoughts, what do you want our viewers to know?
I don't know. That's a good question. I think, just learning more about why facial paralysis happens. It's interesting. It's worthy of exploration. So, and thank you to Dr. Flynn and Casey for everything.
Well, we look forward to having you back and seeing the progress you've made. Thank you so much. Dr. Hawkins, and your final thoughts. Yeah.
Again, another great story. Just, we'll keep everybody updated. Certainly the pandemic, COVID-19 seems to be really decreasing. We just kind of really passed the 3-year mark from our first patient here at the health system. I hope everybody is able to get out, have a good time. Remember, there are things that continue to, that you're battling against, so it's always safe and always good to wear a mask. And please always practice good hand hygiene when you're out as well. Those things will help keep you safe.
Doc Hawk, thank you. Thank you to our guest, and of course, thank you to our viewers for being with us today. Have a great weekend, and we'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update, your mind is like a symphony, 100 billion neurons all firing in harmony. But there's so much about the brain we still don't completely understand. I'm Jessica Lovell. Coming up on the next Morning Medical Update, an expert panel of neurologists helps us understand our own minds, plus how training your brain can break addictions. That's Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.